with surveillance systems, what we're largely talking about is the implied effects. Of course, we are being surveilled for various sort of reasons when we drive our cars on the road and what have you, going into automated systems. But it's this chilling effect that the authorities want to sort of impose generally across the population. They're not actually trying to catch everyone out all the time. They might be trying to catch out particular sort of criminals or individuals, but it's this panopticon effect, the idea that we're all in prison being watched by guards that we cannot see. And if those guards are computers watching our data all the time, this is what people start to think. They think that everything that they do, everything that they put onto the internet, every body that they interact with is collecting their data, and therefore they're being watched. Some of the systems that we have in place, and certainly some of the systems that I've tried to sort of campaign on, have campaigned on, things like the National Identity Register, which was behind the ID cards, would have provided all sorts of ways to watch people, catch people, and make people act in certain ways, to defer to authority. And this is all a way to suppress the population. I'm not saying it's not a totalitarian state, but it's a way to do it gently. If you're doing things to people's data, by and large, you're not knocking down their doors, but it does have this effect. One of the big things about all these data flows as well is that it actually attracts a lot of money and investment, obviously, in the systems themselves. Governments commissioning very, very large data systems from a relatively small handful of global suppliers, but also then these flows of data through the systems. And what we're looking at the moment with Med Confidential is the data that's held and passed around by the NHS. And this sort of information is very, very sensitive information about people's intimate, most private secrets. And what we're finding, in fact, what we just managed to expose in the Sunday Times this last weekend, was that this is being sold under commercial license. A billion hospital records about people who've gone into NHS hospitals have literally been sold to commercial outfits. They're called information intermediaries, and those then have turned a profit on what people's visits to hospital have meant. And we're not talking about something which they're doing in a sort of statistical way. This is about individual patients. We've actually found a picture of what one of the companies that had access to this data has been doing, and it clearly shows they can track people hospital visit by hospital visit as they're getting different diagnoses through the data. And who's getting access to this? It's not researchers and all the sort of people that you might think. It's pharmaceutical marketers, people who are trying to sort of sell their drugs or therapies or whatever it is, back to the NHS. So there's a huge amount of money involved in the sort of flows of data. And of course, with things like when you start to have commissioning, which is this idea in the NHS that you buy services not just from the public sector, but you buy it from the private sector. The money, the sort of data again flows, so the money is following the data. The value of this is not just monetary though. The value of this is information. As I say, these are the secrets in people's lives, the things that they really wouldn't rather disclose. Maybe they'll sort of tell it to their doctor, but they don't want to be telling it to everyone else that might have access through these systems. So the value of this data is really a human value. It's about something about trust in the system. You need to be able to trust that when you go to your doctor, they will keep what you tell them in confidence. And if we lose that trust, you can't put any monetary value on that trust at all. But it's absolutely vital to that relationship between the doctor and the patient, or the service user and the care provider. And it's that sort of side of things which they just don't factor in to these large IT systems. They think it's all about just moving the data around, and they may see an opportunity to, they're calling it drive economic growth. But what about the trust? Yeah, it's literally, this is some of the most valuable. I would imagine that the NHS data set, all of our information, the whole population's information, is one of the most valuable assets, data assets on the planet. Other countries don't have an NHS. They haven't got this richness of information about people's lives, and there are clearly, globally, loads of players who want to get access to this. There's a whole new industry on the horizon where you start to not just have linked medical records, but begin to link in genomic data that's basically taken from your DNA, gene sequencing. That's in the plans further down the line. When the investment comes, if you've got everyone's medical records all in one place, then it's a simple matter of just adding on this genomic data, and that opens up this whole new world of genomic medicine, which we've spoken to gene researchers, sort of medics and academics who look at this, and they say, by and large, it's a bit of a fantasy. This idea that we're going to be able to fix people just by looking at their genes. Certainly there are some conditions, cystic fibrosis for example, where they've identified a particular set of genes and they may be able to come up with therapies, but they've been working for 20 years or more on this and they still haven't. What they are going to come up with is a series of tests, a simple cheek swab or spit test or what have you, which you do and you submit, and someone like, Google spin-off 23andMe processes, and you get something back. You, a healthy person, get something back that says, you have a propensity, you have a chance of developing a really nasty condition. So buy our pill now, and there's no guarantees, but you might tend not to develop that. It's a sort of fear marketing, and that unfortunately is what's most likely to happen, rather than as being sold to the public, them coming up with a whole bunch of new really brilliant sort of treatments or what have you. So as I say, once you start to pull all of people's data together and then be able to do other things with it, it sort of encourages this sort of misuse, abuse of data. And that's plainly what we're trying to stop at the moment. We certainly think that people's information, of course, it has to flow around the NHS for people's care, for actually getting the help that they need, and certainly it needs to go to research to help to help come up with new treatments and what have you. And even it needs to go to pharmaceutical companies, because the research part of a pharmaceutical company, they're testing the drugs, and no one wants to take a drug that hasn't been tested. But for it to leak over into or be sold directly to the marketing divisions of these companies, I think is something which the public is largely unaware of, and most people would be appalled. It's just not what you expect when you go to your doctor for that information, or you go to your hospital for that information to find its way through the system and then be sold on, frankly, industrial scale for commercial exploitation. So, I guess another example of where this might affect someone in their lives, and it comes back to this point about trust, is that everyone has something that they care about and they may not wish to have revealed. And we've been campaigning now for over a year, and actually fairly early on in the campaign, when the people who are driving this program called care.data started to talk about it in public, and that started to be reported in the press or the medical press. Some patients heard things about the system that really worried them. We got a referral from a lady who was referred to us from a rape crisis centre, and she was on a 2-week referral for cancer. She needed to go, and I don't know what it was, but to get a test or something, but it was pretty urgent. And because she had heard one of the people pushing this project say that this was going to reach back 20 years into your GP records, which thankfully now we've managed to stop for the moment, but because she heard that, we can infer that that reached into a part of her life that she didn't want revealed. And that's going to be the same for people going forward as well. If kids have their data uploaded to this system, and it's never going to be deleted when it's up there, you might find you've got a sort of a trail in this system that you can't ever delete, and you can't know what's going to happen to you in 5 or 10 or 20 years' time. So even if you haven't got anything that you're particularly concerned about now, you don't know what's going to happen in the future, and by then it's going to be too late. So it's really important that we do get this right, and that data still, as I say, must flow around the NHS, but it has to be in a very consensual way. So people have to be aware and be able to give their consent and withdraw their consent. It has to be safe, and frankly, a lot of the stuff they're doing at the moment is just not safe. It's not secure. It's revealing way too much information about people, and it doesn't need to. And it must be transparent. And we've got this unfortunate sort of culture at the moment of maybe a bit of doctor knows best, and so people defer to authority. And we need to make things a lot more transparent in terms of publishing what data has been, not the data itself, but what data has been collected and why and what for and who's going to have access to it. We need really strong oversight, independent experts looking at what data is taken and why. And we need, you and I need to be able to know where our individual data has gone. This audit trail, if you like. And if we started to get those sorts of things, it would actually be brilliant for research and for some of these purposes. If someone, a British scientist won the Nobel Prize for medicine in 2020, all those people, if they had this audit trail and knew that their data was a part of that study, would see the value and benefit to society of having volunteered their data. So we don't understand really why this isn't already being done as part of the system. Hopefully, as a consequence of what we're doing, as a consequence of the public beginning to wake up about this, that sort of thing will be required in future. But as I say, that's just within one very large, admittedly, system. Time and time again, we will find other bits of the government or other public bodies that will build systems that are just inappropriate. Personally, I worked on during the sort of No to ID campaign. We worked on all sorts of things, from something called Contact Point, which was gathering up information about children, every child in the country, when in fact what they were trying to tackle was the small but very important percentage who were at risk. We had fingerprinting in schools, which just was completely bananas for accessing library books or lunches. They were putting in essentially biometrics systems that have been developed for the military, and that's a fairly limited market. So if they could get it embedded in schools, that would be great, they thought. We have all sorts of other things which aren't quite systems as well. There's this constant push by Whitehall, by the civil service, by the machinery of the state to be able to share data. They just don't seem to get that it's not theirs. It's not theirs. But just because they've collected it, just because they hold big databases, does not mean that they should be able to join it up around the back or pass it on amongst itself. And what we see is little bits of law here and there that allow connections to be made between large data systems. So they want to link up the tax system to the benefits system or what have you. But these will have massive effects out here in the world. To them it's just an administrative matter. They want to get around what they call the siloing of data. But I say every government pretty much 2-3 years into the term of the government, bureaucratic capture takes place. The ministers basically give up and what have you, and the officials come back with these same proposals time and time and time again. And so we must be constantly vigilant about what it is that people are, large bodies, bureaucracies, companies, corporations, are doing with our data, because it's not trivial. It's not irrelevant. It may not affect you right now in your life, but it could do, not too many years down the line. And actually, if we don't tackle some of this stuff now, it is definitely going to affect our children. Because our children are growing up in a society where it's basically assumed that you hand over all sorts of data. They may be, I think, unfairly called, the Facebook generation or what have you. I think a lot of kids are a lot more savvy about what they do and don't put on social media than some adults, certainly. But it is the case that we are becoming a ubiquitous data society, an information society, an information economy. And if we ourselves don't exert our rights over our data and say this is mine, or even more strongly, this is me, then we could end up further down the line being the equivalent of serfs in a medieval society. Yeah? The serf had no power. They were the peasantry. They might have been vassals who worked for the lords or the barons or what have you, but we end up with a very much less equitable society if we lose control of our data. And that's the most important thing to bear in mind. It's okay, you might not be concerned about this particular issue or that particular issue, but if you let it be nibbled away, you'll look up one day and you'll find you're not in control.